Imagine experiencing chronic dry eyes and mouth, along with fatigue and joint pain, only to be told your tests for Sjogren syndrome are negative. This paradoxical situation is a reality for many individuals. Despite clinical symptoms, standard diagnostic tests may not always confirm Sjogren syndrome, leading to confusion and frustration. Sjogren syndrome is an autoimmune disorder primarily affecting the moisture-producing glands. Its hallmark symptoms include dry eyes and dry mouth, but it can also cause systemic issues such as fatigue, joint pain, and organ involvement. Diagnosing this syndrome typically involves blood tests for specific antibodies, eye tests, and lip biopsies. However, it is possible to have Sjogren syndrome even if these tests return negative results. The complexity of Sjogren syndrome lies in its variability. Not all patients exhibit the same symptoms or antibody profiles, making diagnosis challenging. Blood tests often look for anti-SSA/Rho and anti-SSB/La antibodies. Yet, up to 30% of patients with Sjogren syndrome might test negative for these markers. Consequently, doctors must rely on a combination of clinical evaluations and diagnostic tests to arrive at a diagnosis. The term seronegative Sjogren syndrome refers to cases where patients display clinical symptoms but lack detectable antibodies in their blood. This form can be just as debilitating as seropositive Sjogren syndrome. Without positive test results, patients may face delays in diagnosis and treatment, exacerbating their condition. A key factor in managing seronegative Sjogren syndrome is the holistic evaluation of symptoms. Patients should keep detailed records of their symptoms and any triggers that worsen them. This information can aid healthcare providers in understanding the full scope of the condition, despite negative test results. Another crucial aspect is seeking a second opinion from specialists experienced in autoimmune diseases. Rheumatologists and immunologists are often better equipped to interpret subtle clinical signs and make a comprehensive diagnosis. A multidisciplinary approach involving dentists, ophthalmologists, and other specialists can provide a more accurate assessment and tailored treatment plan. Treatment for Sjogren syndrome focuses on relieving symptoms and preventing complications. For dry eyes, artificial tears, eye ointments, and punctal plugs may be recommended. Dry mouth can be managed with saliva substitutes, sugar-free gum, and good oral hygiene. Systemic symptoms might require medications like hydroxychloroquine, which can modulate the immune system and reduce inflammation. Living with seronegative Sjogren syndrome demands a proactive approach. Patients should maintain open communication with their healthcare team, advocate for their needs, and stay informed about the latest research and treatment options. Support groups and patient organizations can also provide valuable resources and emotional support. Have you or someone you know faced challenges with a negative test result for Sjogren syndrome despite having symptoms? Share your experiences and thoughts in the comments below.